Hello, thank you for visiting the Vanderbilt Online Guide to Children's Health. This site was created to serve as a guidance and technical assistance for the implementation of coordinated school health. The following presentation serves as trainings to enhance knowledge and skills as it relates to coordinated school health and its 8 components. Thank you for joining us today. Today we will be presenting an overview of coordinated school health programs. The purpose of today's presentation is to raise awareness of the benefits of a coordinated school health program, inspire action, and provide knowledge and resources for successful implementation. If at any time during the presentation you have questions regarding coordinated school health or any of its 8 components, please be sure to visit our website at www.childrenshospital.vanderbilt.org. We hope that this presentation will provide better insight into why coordinated school health can be effective in your school and why it is important to overall well-being of students and their health. By the end of this presentation, you will be able to define coordinated school health, name and explain its 8 components, identify key stakeholders to involve in your program, identify best practices for implementation, and be able to find resources to help you develop an effective coordinated school health program. So before we begin, it's really important that we all have a good understanding of what coordinated school health is. So in order to better do that, I'm going to provide a bit of a definition from the Centers of Disease Control and Prevention. According to the CDC, coordinated school health is a systematic approach to improving the health and well-being of all students so they can fully participate and be successful in school. It's a really collaborative effort among school administrators, teachers, cafeteria staff, students, families, and communities. It involves the assessment of current student health needs, setting priorities, as well as planning, implementing, and evaluating all health-related activities. You're probably wondering why a children's hospital would place such emphasis on school health. But if you look at it, a student's academic success greatly depends on their overall health and well-being. If a child is missing school every day because they're having issues with their own health, they're less likely to be successful. They're not meeting with they're not getting the support from their teachers, they're not getting support from their peers, and they're overall just not going to have a good academic experience throughout their lifetime. Next to the family, schools have the greatest influence on a child's health because they have the most contact with them. Schools have direct contact with more than 95% of our nation's young people aged 5 to 17 years old for about 6 hours a day and 13 critical years of their social, psychological, physical, and intellectual development. And if you think about it, that's about 14,000 hours of contact over an educational lifetime. Coordinated school health is really there as to bridge the gap of student health. It's there to provide a unified voice for the schools to make sure that the right messages are being delivered and that it's on a consistent basis. So from the school's perspective, coordinated school health really identifies program gaps where they can strengthen their weaknesses. It helps reducing program overlap, making sure that the programming is delivered in the most efficient manner as possible, and that every type of programming is deliverable. It also strengthens the school community by getting parents and the rest of the community involved in the school, and builds community partnerships and communication. Like I had mentioned earlier, coordinated school health is really a collaborative effort among parents, teachers, administrators, and even community members. Before we get started building your healthy school teams or thinking about who you're going to bring in, it's important to identify key stakeholders. This is a list of who you might think about: classroom teachers, school nurses, cafeteria managers and staff, principals or school administration. Students are always a big plus to get on board. Parents, physical educators, psychologists, school counselors, community health organizations, school board members, and even sports or athletic coaches. Now we're going to show you a video on the current coordinated school health efforts across the state of Tennessee. In addition to having this video, we also have some podcast interviews with Nicole Profit from Metro Nashville Public Schools Coordinated School Health Program, as well as Rebecca Johns-Womack from the state of Tennessee. So please be sure to check those out on our website after the presentation is over. Coordinated school health really is a systematic approach to addressing issues of student and faculty health and wellness. Unlike your basic school health programming, coordinated school health is comprised of 8 interrelated and equally vital components. These components include health education, physical education, health services, nutrition services, counseling and psychological and social services, healthy and safe school environments, staff wellness, and family and community. In the following slides, we're going to really discuss and go into greater detail of each of these components and how they affect the schools. The first component of coordinated school health that we're going to touch upon today is physical education. And physical education really goes beyond the classroom, so not just your standard PE class, but also incorporating physical activities in the school, other school subjects such as English, math, science, things like that. With obesity rates on the rise among students, as well as the abundance of technology that is at our fingertips and the overemphasis of state testing on the students, it's easier than ever to be physically inactive. And it's important to bring physical activity back to the forefront. For younger kids, those who are able to receive at least 20 minutes of recess per day are likely to have a lower body mass index than those of their peers that don't. In addition, states that require PE in high school, the girls are more likely to be active by more than 37 minutes per week. As it relates to safe routes to school, any student who's able to walk to school is more likely to receive about 24 extra minutes of physical activity compared to those who don't and are more likely to take the bus. In addition, as it relates to academic achievement, 20% of students are more likely to get an A in either math or English if they're being physically active on a regular basis. Classroom PE is very important for overall student health. It promotes physical, mental, emotional, and social development, as well as building healthy habits throughout a student's lifetime by displaying activities that can be incorporated in everyday life. For many states, PE is no longer on the radar. Many students are not required to take PE like they might have been when I was going through school. Some students might only get 1 year of PE through their 3 years of middle school, or 1 year of PE in all 4 years of high school. And coordinated school health really brings the emphasis back on physical education and hopefully the incorporation of physical education throughout the school week. The next component of coordinated school health that we're going to touch upon is health education. And really, health education focuses on addressing the physical, the mental, emotional, as well as social dimensions of health. These activities are typically planned, sequential, and built into the pre-K through 12 curriculum. And in order for health education programs to be successful, they really should be integrated into the daily activity or the daily life of the students. It shouldn't just be going into a classroom. The main goal is for students to develop and demonstrate health-related knowledge, attitudes, skills, and practices. Again, developing those lifelong habits that can carry on with students through, well after their education is over. Some topics that can be included are personal health, family health, community health, consumer health, environmental health, mental health, injury prevention, CPR, nutrition, disease management, and substance abuse. The responsibility of health education doesn't just rely on the school health educator, but really a well-rounded focus, thinking about how teachers role model their behaviors in the classroom, the way that school counselors deal with students, and thinking about school nurses, the opportunity that when a student comes into the clinic that they're able to provide health education during their visit. Other people to think about bringing in are registered dietitians and community health care professionals to provide supplemental health education throughout the day. One of the most important components of coordinated school health is in student health services. Health services are provided and supervised by school health nurses to assess, protect, and promote the overall health of students. Unfortunately, not every school has opportunity to have access to a student nurse, but those that do really have an advantage because students gain quick access and understanding of their own health. Services provided by school health services include assessment, planning, and coordination of services and direct care for children, including those with special care needs. The main goal is to provide opportunities for early intervention, access to primary health care services, prevent and control communicable diseases, and provide emergency care and daily and continuing services. Lastly, it's the aims to increase knowledge and provide educational and counseling opportunities. Like we said previously with health education, it's really important that school nurses understand the opportunities that to provide health education whenever possible. Any qualified professionals in the school, such as nurses, physicians, psychiatrists, psychologists, dentists, health educators, dietitians, counselors, and allied health professionals, are really important and responsible for the carrying out the health services. Nutrition services is easily one of the most important components of coordinated school health effort. If you think about it, for students who are on free and reduced lunches, 2/3 to 100% of their daily caloric intake is going to come from the schools. So it's really important that schools provide the most nutrition and the healthiest foods available so that students are successful in and out of the classroom. Each school's nutrition program really offers a learning laboratory for classroom nutrition as well as health education. Students are able to directly bring the skills that they've learned in their health education curriculum to the cafeteria when selecting their foods. They can think about some of those components they've learned in the classroom. In addition, really, the nutrition services help to develop those healthy eating patterns and concepts among the students. It reinforces those behaviors and helps to develop those skills that students can take with them outside of the school day. Then lastly, nutrition services really provide the students with the optimal opportunity and readiness to learn in the school and in the community. The next component of coordinated school health that we're going to touch on is staff wellness. Staff wellness is really important to the overall academic success of your school. If you think about it, just as health is important to the students and their academic success, if your teachers are out on a regular basis due to illness, they're not going to have that contact and or be able to provide the support that the students need to be academically successful. In addition, as much as they may not want to admit, students really do look up to your teachers and your staff and try to mimic many of the behaviors that they might carry on a regular basis. Staff wellness really provides the opportunity for to be successful, healthy role models, which provides students with the skills to develop lifelong healthy habits that they can take with them outside of the classroom. A solid staff wellness program is going to be really important for your teachers as well. It's going to amp up their productivity and make coming to work on a regular basis more exciting for them and make it an enjoyable experience. Employee wellness programs should really promote healthy behaviors and reduce health risks through identifying and correcting conditions in the workplace that may negatively affect the health of employees, reduce employee or student productivity, and could contribute to the health care costs. As they always say, a healthy staff is a happy staff. A healthy school environment can really set the tone and drive the overall health and well-being of your school, and is the next component that we're going to talk about when it comes to coordinated school health. A healthy school environment ensures a physical and psychosocial school environment where students, teachers, and faculty members feel safe and their health is not at risk. Some environmental factors that you might want to think about when you're looking at the overall well-being of your school is the physical school building itself, that it provides a safe environment that is not going to be taxing on the students and the staff. Thinking about the school neighborhood, is your school neighborhood a safe place for students to be walking to school or just to be playing when they're out at recess? Thinking about toxic biological or chemical agents that might be in the air, the water, or even in some of the paint that might be throughout the school. A healthy school environment is not just dependent on the physical environment, but also the psychosocial and the social aspects of the environment. Thinking about the physical, the emotional, and social climate, you want to think about things such as bullying, violence, and stress that might be taking place within the school. Studies show that students who are bullied on a regular basis are not going to have as high a self-esteem or be as confident in their academic studies and are not going to want to attend school on a regular basis. So thinking about what is going on in the school as far as those aspects are concerned. One of the most underrated components of coordinated school health is family and community involvement. Today it can be really hard to get parents and community involved in the school. With parents being pulled in multiple directions and having a lot on their plate, they just don't have time to be involved in the school as much as they may want. But if you can really drive the importance to the families and the community of their involvement in the school, I think you can have a greater success in getting them to participate on a regular basis. So what is parent and community involvement? It's the ability for schools to actively solicit the involvement of parents in the community to raise awareness and to build support for the school health program efforts. As I said earlier, um, studies have shown that an integrated school, parent, and community approach has been shown to really greatly enhance the health and well-being of students and also to drive academic success. Um, the more that parents are involved in the schools, the more that they're able to get involved in their own students' lives, and the more that they're able to provide support and to continue to drive that. The main goal of the parent and community involvement is to raise awareness and to build support for school health program efforts by actively getting the parents involved on the daily the daily lives of the students as well as the daily lives of the programming. You can really create a coordinated effort and drive the success of the health of the school. The last component that we're going to touch on is the counseling and psychological services. The goals of this component are to enhance and promote academic, personal, and social growth through providing all students with services such as developmental, classroom guidance activities, and preventive education programs. Activities might include psychometric or psychoeducational tests, observational assessments, individual and group counseling sessions, crisis intervention for emergency mental health needs, maybe family and home consultations, or even referrals to outside community-based agencies if possible. Really, this lies on the responsibility of this lies on qualified professionals such as your counselors, community psychologists, school nurses, social workers, and outside agencies that might provide services to the school. When you think about, as it comes to academic success, this is probably one of the more important areas that a student is able to succeed and get the support that they need so that they have the confidence and the ability to perform in the classroom. Now that we have a better understanding of what coordinated school health is, as well as the 8 components that make up an effective coordinated school health program, it's really important to start thinking about the implementation of an effective coordinated school health program in your school. We're going to provide you some tips and best practices for making sure that your program is as effective as it can be. One of the most important things you can do is really secure the support of your school administration. Without their support, you're really not going to get the traction that you need to drive the efforts in your school. You're going to want to create a healthy school team to assess your school health needs, set priorities, as well as design solutions. And thinking about who you want to bring in on that healthy school team is going to really determine whether or not that healthy school team is able to provide those services. You're going to want to identify a school health coordinator, somebody that is going to really be the leader behind this. Build strong school community and connect with community partnerships. Really, you can't drive an effective coordinated school health program without having community partnerships to help you supplement services that you may not be able to provide on your own. You're going to want to develop a plan as well as identify adequate time and resources available to fulfill that plan, and provide professional development for staff, making sure that all staff are on board of the changes, and provide support for the services that you're going to provide. And finally, you want to create a safe and a supportive environment for students and staff, not only to drive success of academics, but also to make sure that any ideas that are brought to the table are going to be welcome with open arms and not criticism. So these are some really good tips to help you get started on your coordinated school health program. Whenever you first begin the process and take a look at coordinated school health, it can seem like a really overwhelming process, but really it's not. It's really easy to follow and easily replicable among the schools. One great success story takes place in Gibson County Special School District. They've been running a program for about 8 years now, and their county has really achieved its goal of fostering academic achievement and lifelong wellness for staff, students, and families. The following is a list of the health initiatives that connect good health practices for staff and students and families with a healthier school environment. The first thing they did was utilize the Michigan model, which is a school health education program to increase students' health, knowledge, and skills. They run 14-week life skills programs to reduce drug use in middle schools, which is led by the Tennessee National Guard Counter-Drug Task Force. They run Right Choices of Western Tennessee, which provides a youth development program to reduce risk behavior. They offer students a variety of opportunities for physical activity, as well as promote healthful diets by sending NutriNotes newsletters for students and parents. Registered dietitians often work with the Healthy School teams to develop individualized plans for students and staff members needing assistance. School nurses organize health screenings for students and staff, and school counselors provide suicide prevention training for staff to provide assistance to parents with Cover Kids. If you'd like more information on this program, please visit the website listed on the slide. I really want to provide you an opportunity to take a few minutes to put everything that you've learned to practice. We're going to do a little bit of a brainstorming activity. And what I want you to do is think of 3 activities that could be implementing in a coordinated school health program. What stakeholders would need to be involved, and which of the 8 components of coordinated school health do these activities fall, as well as what resources would you need to create and implement an activity successfully. Please pause this presentation while you go ahead and work on those 3 questions, and whenever you're finished, just go ahead and start back up. If you're interested in getting started with a coordinated school health program in your school, please feel free to visit the CDC's website. It's cdc.gov/healthyyouth, and then you can see the rest there. But the site really provides some great tools for assessing and planning, some tools for collaboration and partnerships, evaluation tools, some parent and family involvement tips, some policy information that you may not think of, professional associations links, professional development links, as well as promising practices information, so you can see some other success stories throughout the country in addition to the one that we gave you with Gibson County. The CDC offers free workshops to help guide schools in the implementation of coordinated school health programming. CDC experts will aid schools in the proper usage of training tools that can be used to assess the health environment, create healthy school programming curriculum, as well as rally support for coordinated school health programming. The CDC will pay for all the expenses associated with the trainer. That includes travel, lodging, per diem, and honorarium. And the school will need to cover any additional costs associated with the workshop. For example, facility, copying of certain materials, as well as refreshments. In addition to the workshops, coordinators will be responsible for following up with participants up to 12 months following the workshop to gain information regarding specific steps and actions accomplished and report back to the CDC. And please follow these easy steps that we've provided to get started. Let's go ahead and review some of the learning objectives we covered in this presentation. Try not to look at the screen while we ask you these 4 questions and write down your responses. What are the 8 components of coordinated school health program? Name 3 of the best practices for implementing coordinated school health programs. Name 4 different coordinated school health stakeholders that might be involved, and name 1 resource that will help you get started with your coordinated school health program. After you've finished writing down your responses, please check back with the slide to see the correct answers. Lastly, we have provided you with some additional resources to make sure that your coordinated school health program is a huge success. If you have any questions, please feel free to email us. Our information is located on the last slide. As well as check out our website. It's www.childrenshospital.vanderbilt.org. Coordinated school health really is a fantastic way to bring students, staff, and community health to the forefront. A successful program will be a collaborative effort with a systematic approach. We hope this presentation has given you a better understanding of coordinated school health. Please feel free to email us with any questions you may have regarding starting a successful program. Please check our website for more information as well as future trainings. And thank you for joining us.